Welcome to the deep dive. Today, we're embarking on a really crucial exploration, getting into the very bedrock of psychiatric mental health nursing. So, if you're a nursing student, maybe right in the thick of your studies, or just someone curious about the mind and how we care for it, this deep dive offers a pretty vital perspective. Our insights today, they spring directly from a foundational text for nurses. It's a chapter from Margaret Jordan Halter's Barcarolis's Foundations of Psychiatric Mental Health Nursing, a clinical approach, the 8th edition. But think of this less like a dry textbook, yeah, and more as a powerful roadmap for your future in healthcare. Our mission today is pretty clear. We want to distill the essential concepts mental health, mental illness, and the truly pivotal role of the psychiatric mental health nurse. We're aiming to cut through the noise, help you connect these core ideas to your college studies, get you ready for actual clinical practice, and yes, even sharpen things up for the NCLEX, because this isn't just about memorizing facts, right? It's about building that foundational empathy and critical thinking you'll use every single day to really impact lives. Okay, let's unpack this. Let's start with a concept that's absolutely fundamental, the mental health and mental illness continuum. It's really vital to grasp that this isn't like a simple on-off switch. You're not just healthy or ill.
It's exactly.
Instead, it's a fluid dynamic spectrum, kind of like a sliding scale maybe,
Yeah.
where someone's constantly moving, sometimes towards, optimal well-being, other times maybe encountering the challenges of mental illness, and often, existing somewhere in between. So if it's this dynamic sliding scale, what's the key thing that helps someone navigate it, to bounce back when life throws curveballs?
Yeah, that's where resilience really steps in. And resilience isn't just, a buzzword. It's that really remarkable capacity to adapt, to bend without breaking, to recover from adversity, trauma, significant stress. For us as nurses, recognizing and frankly fostering resilience in our patients is absolutely indispensable.
Right.
It acts as a powerful protective factor, helping maybe prevent the onset of mental illness. And it's absolutely crucial in the recovery process when someone is facing mental health challenges. It's about adapting well, basically.
Yes. Okay, adapting well. And speaking of factors that kind of push and pull people along this continuum, our source really emphasizes a range of influences. We can broadly sort them into 3 interconnected areas, seems like. First, you have individual attributes and behaviors, things like a person's basic temperament, their coping skills, self-esteem, maybe even how they manage their physical health.
Yeah, the personal stuff.
Then there are the social and economic circumstances, which have a huge impact on well-being. Think family stability, access to resources, community support, socioeconomic status.
Big factors, definitely.
And finally, we consider environmental factors, things like broader cultural norms, access to good health care, or even exposure to, say, chronic stress or community violence. All these elements are constantly interacting, creating this unique tapestry for each person's mental health journey.
And what's fascinating there is how these interconnected factors shape an individual's journey along that continuum. Yeah. And also how they've historically influenced our very perceptions of mental health and illness. For so long, mental illness was viewed so differently from physical illness.
Oh, yeah.
Often stigmatized, right? Seen as a character flaw, maybe, rather than a legitimate medical condition.
Totally different from how we'd treat a broken arm or something.
Exactly. And then there's that age-old nature versus nurture debate. Is it all genes, or is it environment and upbringing? The truth, as the source points out, is almost always a complex interplay. Genetic predispositions, they can be activated or maybe lessened by environmental factors. It's rarely just one or the other.
It's how they dance together.
That's a good way to put it, yeah. How they dance together truly matters.
Okay, so we've established mental health isn't static, and it's influenced by so much around us. But how did our approach to mental health care evolve? What were the big shifts, that brought us to where we are today in the U.S.? It's not like it happened by accident, right?
Not at all.
It's the result of decades of advocacy, scientific breakthroughs, and these, profound societal shifts. We've seen these pivotal movements fundamentally reshape care. Think about the consumer movement.
Really powerful.
That was a huge push from individuals with mental illness and their families. They demanded more autonomy, respect, and it shifted the whole paradigm towards mental health recovery.
Empowering people.
Exactly, empowering individuals to live full, meaningful lives despite their illness. And alongside this, you had scientific leaps like the decade of the brain back in the 90s.
Huge for neuroscience.
Right. Revolutionized research, improved our understanding of brain function, mental disorders. Then, pretty quickly, the Surgeon General's report on mental health came out that officially said, hey, mental health is fundamental to overall health, helped destigmatize things, highlighted the need for real treatment. Then came the Human Genome Project, unraveling the genetic code, opening new doors for understanding, the genetic side of psychiatric
Yeah, the
disorders.
biological underpinnings.
These efforts, combined with reports from the Institute of Medicine and initiatives like the Brain Initiative, that's brain research through advancing innovative neurotechnologies.
What an mouthful.
It is. And the RDOC Initiative Research Domain Criteria, they've all collectively pushed us away from just custodial care towards integrated, biologically informed, recovery-focused approaches.
RDOC is interesting too, shifting from just symptom clusters.
Right, to understanding the underlying brain circuits and behaviors. So why does this matter to you as a nurse? Well, it means future treatments might get way more targeted, closer to personalized mental health care.
Like precision medicine in other areas.
Exactly.
And if we connect this to the bigger picture, these initiatives, they truly reshaped our approach. They moved us away from just institutions and focusing only on pathology, towards community care, destigmatization, and really emphasizing recovery and those biological links we just mentioned. They definitely paved the way for how we understand and treat things now.
And these scientific, social movements, they didn't happen in a vacuum, did they? Crucial legislation and mental health funding have been absolute game changers. The concept of mental health parity is huge here.
Essential.
It's the idea that mental health benefits should be equal to physical health benefits. Insurers can't just discriminate against people seeking mental health care. It's been a long fight, but it's vital for fairness.
Still fighting it in some ways.
True. And then the Patient Protection and Affordable Care Act of 2010, the ACA, that had a massive impact. Expanded coverage for millions, mandated mental health and substance use disorder benefits.
Yeah, increased access significantly.
These laws are key to improving access, affordability, making mental health care, hopefully, a more integrated part of the whole system.
Which leads us nicely into why understanding the epidemiology of mental disorders is so important. Epidemiological studies, they're basically these large-scale investigations looking at patterns and causes of health conditions across populations.
Yeah.
For mental health, these studies give us crucial insights. Things like prevalence, how many people are affected by specific disorders, and how they're distributed across different groups.
So who is most affected? Where?
Exactly. And this data is invaluable because it helps improve care. It informs how resources are allocated, guides prevention strategies, highlights populations maybe at higher risk. It gets us from just stories to actual data.
Right, data-driven understanding. Asking, where are the greatest needs?
Precisely.
And when it comes to actually classifying these disorders, nurses really need to be familiar with the main tools clinicians use. Primarily, we're talking about the DSM-5.
The Diagnostic and Statistical Manual, 5th edition.
Think of the DSM-5 not just as some diagnostic Bible, but maybe like the Rosetta Stone of mental health.
I like that.
It's the standard system used by mental health pros in the U.S. to diagnose psychiatric conditions. It gives specific criteria for lots of disorders, helps ensure consistency between different doctors, different places.
Yeah, a common language.
Right. And while it's the psychiatrist or another qualified pro who makes the medical diagnosis using it, as a nursing student, understanding its categories and criteria is absolutely essential. You're not just reading words on a chart, you're translating someone's lived experience into that common language so the whole team can understand, plan, and intervene effectively.
It's less about memorizing every single criterion.
Yeah. More about seeing the connections, symptoms, diagnosis, the human story underneath. And briefly, you'll also hear about the ICD-10-CM. That's the International Classification of Diseases, 10th revision, clinical modification.
A bit prouder.
Yeah, exactly. While DSM-5 is psychiatric-specific, ICD-10-CM covers all diseases and health problems globally, including mental health stuff. It's mostly used for coding diagnoses for billing, statistics.
So DSM-5 gives the criteria.
And ICD-10-CM gives the code for it.
Okay, so what does this all mean for you as a nursing student? Try and understand criteria. Get ready for NCLEX.
It means that while nurses don't diagnose using the DSM-5, not in the same way a psychiatrist does.
A foundational understanding of its categories, its criteria, is absolutely crucial. You'll be interpreting care plans, recognizing symptom clusters, communicating effectively with the whole team, and developing your nursing care based on these diagnoses. Your role is more about observing, assessing, providing care, not assigning the formal medical diagnosis.
Got it. So it helps you anticipate patient needs, tailor your interventions.
Exactly.
Which brings us right to the heart of this deep dive. What is psychiatric mental health nursing? It's this dynamic, specialized field where nurses focus on promoting mental health, preventing mental illness, and caring for individuals, families experiencing mental health challenges.
And it's so much more than just medication management.
Right. It's about providing holistic, compassionate care, considering the patient's entire well-being. Like, imagine a patient who feels totally alone, even if their family's right there. Holistic care addresses that, not just brain chemistry, but the isolation, the fear, the struggle to connect. It's that blend of science and human connection that makes PMH nursing, well, unique.
And within this specialty, understanding the classification of nursing diagnoses, outcomes, and interventions is a core competency for every nursing student. This is where we really distinguish between that DSM-5 medical diagnosis and a nursing diagnosis.
Okay, so how are they different?
Think of it like this. A doctor might diagnose major depressive disorder. That's the medical what. But your nursing diagnosis, something like hopelessness related to long-term stress, or maybe self-care deficit related to depressive symptoms, that's your clinical judgment.
About the patient's response to the what's.
Exactly. It's your lens on how the illness impacts their life right now. And it directly tells you where you can intervene as a nurse.
It's like the difference between naming the storm and describing how it's affecting this particular house.
Perfect analogy. And these nursing diagnoses, specifically the NANDA-I approved ones, they guide your independent nursing actions. From there, we move to the Nursing Outcomes Classification, NOC. This is how we define measurable patient goals.
Measurable goals. Okay.
So if your nursing diagnosis is hopelessness, a NOC outcome might be something like hope or mood management, with specific indicators you can actually observe and evaluate over time, see if your interventions are working.
Like benchmarks for improvement.
Precisely. For self-care deficit, a NOC outcome could be self-care, activities of daily living, with benchmarks like patient will perform daily hygiene independently by day 3. These are the targets you aim for, ideally with your patient.
Right. Collaborative goal setting.
And finally, the Nursing Interventions Classification, NIC. This guides your evidence-based nursing actions.
The how-to.
Basically, yes.
Yeah.
If the patient has hopelessness and the outcome is hope, your NRC interventions might include things like coping enhancement or emotional support, detailing specific actions like encouraging them to express feelings or identifying their strengths. For self-care deficit, NEC interventions could be self-care assistance, bathing hygiene, or medication management, giving concrete steps like assist with morning care, allowing patient to do tasks as tolerated. These classifications create that common language for nursing practice, ensure consistency, quality care. They're what you'll actually be documenting and doing every day.
It's also important to understand the different levels of psychiatric mental health clinical nursing practice. There's the basic level. These are registered nurses providing direct care, usually with an associate or bachelor's degree. So a basic level nurse on an inpatient psych unit. They might be giving meds, doing psychoeducation about a new diagnosis, maybe leading a therapeutic group on coping skills.
Managing the milieu, doing screening.
Exactly. Managing the therapeutic environment, conducting health screenings. Then you have advanced practice psychiatric mental health nurses. These folks are typically prepared at the master's or doctoral level.
PMHMPs, clinical nurse specialists.
Right. And the roles are much broader. This includes psychiatric mental health nurse practitioners, PMHNPs who can diagnose mental disorders, prescribe psychotropic meds, do therapy, individual or group, provide really comprehensive assessment.
A much wider scope.
Definitely. So an advanced practice nurse might be leading a patient's whole treatment plan, developing a complex medication regimen, maybe providing long-term therapy for someone with chronic illness, working closely with other providers, even supervising basic-level nurses.
It really highlights the range within the specialty, doesn't it? The different paths you can take.
It does.
But ultimately, regardless of the level of practice, psychiatric mental health nursing is really defined by that holistic, patient-centered approach. It's about blending deep scientific knowledge brain, mental illness with profound empathy, and really strong therapeutic communication skills. It's truly a unique intersection of science and humanity.
Where your head and your heart have to work together.
Absolutely. Couldn't say it better.
So as we look ahead, this field faces several evolving future issues. These are the challenges, the opportunities that will likely shape your careers. Educational challenges are ongoing, right? Making sure nursing programs keep up with the latest research, best practices, especially when things change so fast.
Always playing catch up, seems like.
And then there's the huge impact of an aging population.
Mhm.
As people live longer, we see more age-related mental health conditions, dementia, depression, which demands specialized care from nurses everywhere, not just in psych settings.
Yeah, it touches all areas of nursing.
Cultural diversity is also more critical than ever before. Nurses have to develop real cultural competence to provide fair, effective care to patients from all sorts of backgrounds.
Understanding how culture shapes distress, help seeking.
Exactly. How people express distress, whether they seek help, what treatments they prefer. And finally, science, technology, and electronic healthcare are just rapidly transforming the field.
Telemedicine, digital therapeutics.
Yeah. AI diagnostics, electronic health records, it all requires nurses to adapt, learn new skills, use technology for the patient's benefit. It's kind of a new frontier for care delivery.
Which raises a really important question, I think. How can nurses truly be patient advocates in such a complex system, especially with these future trends? Advocacy and legislative involvement are, well, they're integral parts of a psych mental health nurse's role.
Right.
You have direct advocacy opportunities.
Like speaking up for your specific patient.
Right. Speaking up to their rights, ensuring they get the best care, empowering them to voice their needs. It can mean challenging a treatment plan that doesn't feel patient-centered, or helping someone navigate insurance approvals for a med. But there are also indirect opportunities, engaging in legislative efforts, joining professional organizations, participating in policy discussions that influence funding, parity laws, access to services. Your voice, because it's informed by that direct patient care experience, can be incredibly powerful in shaping mental health policy down the line. But given how complex these systems are getting, what's maybe the biggest hurdle you see for a new nurse trying to advocate effectively? Say, for a patient using telemedicine for the first time.
That's a great point. It's not just about the direct hands-on care anymore, is it? Your real-world responsibilities will increasingly involve actively adapting to these tech advances and becoming, well, fierce advocates for your patients, for the profession. It's about being proactive, engaged, not just reactive, especially in a system that's constantly changing. So, as we start to wrap up this deep dive, we've covered a tremendous amount of ground, from that dynamic mental health continuum and the crucial role of resilience to the complex web of risk factors.
Yeah, a lot to unpack there.
We journeyed through the historical shifts that shaped mental health care in the U.S., exploring how movements and laws led us to where we are now. We tried to demystify diagnostic tools like the DSM-5 and ICD-10-CM, clarifying their roles for nurses.
Which is key.
And we really honed in on what makes psychiatric mental health nursing unique, detailing the importance of nursing diagnoses, outcomes, interventions, and the different levels of practice. That blend of knowledge, critical thinking, and deep empathy really defines the role.
Which brings me to a final thought, maybe a question for you, our listeners, as future mental health professionals. How can you personally contribute to destigmatizing mental illness and fostering a more compassionate society? Starting right now with the knowledge you're building today.
That's a fantastic thought to leave everyone with. Thank you so much for joining us on the deep dive. Keep learning, keep questioning, and keep exploring. We'll catch you next time.